My name is Ezekiel Oburu. I am an orthopedic surgeon, and today I'm here to talk about common foot problems. So the foot is very interesting, 26 bones, a number of joints, quite a complex structure. And when we talk about foot and ankle problems, we're talking about problems from the toes here all the way to the ankle. The ankle is this joint here, but above this joint, that's where we're talking about. Now, one of the most common foot problems that I see in my clinic is plantar fasciitis. I see a lot of patients with plantar fasciitis. And the plantar fascia is essentially a structure that comes all the way from the heel here, and it comes all the way to the toes here. And sometimes it gets inflamed, fascia, the structure, fasciitis, inflammation. So the plantar fascia, when it gets inflamed, you get a lot of pain over here at the insertion of the plantar fascia. And the patients will wake up in the middle of the night. Not really in the middle of the night. Yes, when they're going to maybe the bathroom, or even when they wake up in the morning, they say, "Doctor, my first steps are so painful." Or after sitting for a while, it's really painful when I get up. So how do we manage plantar fasciitis? First, you need to go and see your doctor, and your doctor will examine. Usually, there's pain just at that region of the insertion of the plantar fascia. There are a number of things that we do with patients with plantar fasciitis. What I usually tell my patients, patient will tell you, "Look, I have a SPA." I say, "Well, that's not quite the name we like to use as orthopedic surgeons. We prefer the term plantar fasciitis." But I straight away tell them, "Look here, after examining them, I want to show you something." I go to Google and I say, "Well, plantar fasciitis stretches." In fact, many a times I've done that so many times on my phone, it just shows. So when we look at plantar fasciitis stretches, I tell them, go to Google Images, and they look at Google Images, and Google Images will show them the various stretches. And I tell them, just go ahead and do this. I tell them you can do this for YouTube, you can do, and stretch. That's what I tell them. One of the common stretches that I do is I tell them they can do that, and they can massage there. And that really works, okay? There are various stretches, really. If you're suffering from this, just go to Google and you'll be able to see Instagram, Pinterest. There's a lot of stuff about plantar fasciitis. But not all pain in the foot is plantar fasciitis. There are many other conditions. Another condition is Achilles tendinitis. And these patients just complain of pain around here. A number of times they are runners, so they complain about pain in the Achilles tendon. And sometimes they can have pain at the insertion of the Achilles tendon. So you can have this, which is non-insertional Achilles tendinitis, or you can have one at the insertion of the Achilles tendon. Once again, what's the treatment? And the treatment is usually eccentric stretching. So if you Google eccentric stretching or eccentric stretching, depending on the school you went, really that is the treatment that we usually do. On occasion, if it fails, we do surgery. If it fails, we do surgery. And I've seen this quite commonly. I think last week I did operate on a patient with insertional Achilles tendinitis, and she had suffered for years with this, and had not received the diagnosis. But we operated on her. It will take a while for her to recover, but hopefully she will recover. Plantar fasciitis, on the other hand, unlike Achilles tendinitis, we rarely operate on it. I've been doing this job for some time. I've only done one case of plantar fasciitis. So I avoid the surgery as much as I can. There are operations that I do in my practice that are similar to that operation we do, but specifically for plantar fasciitis, it's one patient who, despite stretching, despite doing all sorts of things, she just never got better. So I decided that I will operate on her. The other condition that we get, and our model here, Chantel does not have it, but it's called hallux valgus, or a bunion. And if you see, that's a bunion. This is where a bunion appears. You can see Chantel's foot is quite straight, but sometimes you find somebody has a foot that is like that, and that's called a bunion. And usually in a bunion. Sometimes they may complain of pain around this region, or they can't get on various types of shoes that they would like. So what do we do? Not all bunions are treated, surgically. If the patient does not have any pain, if they can modify their shoe so that they use a wide toe box shoe, that's good. But sometimes if they're not getting better, we may decide to do an operation which will straighten the toes. The other condition that you may get is a hammer toe. So sometimes you get, like Chantal's toes are quite straight, but sometimes you may get a patient with toes which are like this, and that's called hammer toes. And we do an operation to straighten those. There are certain things you can wear also that can keep them straight, but sometimes we do an operation to straighten those. Now, sometimes patients complain to me that, doctor, I have a lot of pain. I have a lot of pain mainly around this region. And when I examine, I find that they have a lot of pain mainly in between the third and the fourth toe around here. And that's called a Morton's neuroma. It's quite a common thing, actually. Quite a number of patients complain. In fact, when I see a patient with non-specific pain, I always look for a Morton's neuroma. So what do I do with a Morton's neuroma? Treatment, sometimes you may get an insole that may offload the nerve. A neuroma is just inflammation of the nerve. And sometimes I give an injection. Very rarely. I did one about 3 or 4 weeks ago. We may do an operation. Now, the other foot problems that you may get, one is you may get patients with a high arched foot. So if you look at the foot is more or less like that. It's really high arched. And sometimes it's bent all the way in. And some people may think that this is a club foot, but it's really not really a club foot. It's a high arch foot. It's called a caver's foot deformity or a cavovarus foot deformity. That usually requires surgery. That is very rarely treated without surgery. So it usually requires surgery. And then you may get patients with flat feet, so Chantel's foot are quite normal here. They're not flat, but you may get that a patient has got no arch whatsoever. And there are many causes of flat feet. We can't cover them in this simple video. Needless to say, that some we may treat. If you have flat feet and they're not painful, we don't need to treat them surgically, but some may require surgical treatment. That, in a nutshell, is some of the common foot problems that we have in orthopedics. Thank you very much. Thank you for joining us in this episode in conjunction with Ponea Health. We look forward to seeing you in the next episode. Find our services at ponea.com.